As you can imagine, finding out that your newborn child was born with a skull abnormality, surgery needs to be done to correct it, is an extremely scary thing to hear.
The way that I usually describe craniosynostosis to families, I say that I think about the brain and the skull like a balloon inside of a box. The walls of the box are touching each other, but they're not stuck together. And so as you blow up that balloon, the walls get pushed apart from each other. And in craniosynostosis, one or more of those walls are stuck together too early. The brain will push the walls that it can push and will not push the walls that it can't push. And this creates growth restriction and brain development restriction, etc.
Cleft Lip and Palate is a multidisciplinary team. We have providers from plastic surgery, from ear, nose, and throat, dentistry, orthodontics, genetics, social work, pulmonology, really a wide variety of providers, including behavioral health providers, myself, pediatric psychology.
We really try to emphasize a family-centered approach to children here at WVU Medicine. We make sure that the families are with the kids as much as possible up to the time of surgery and as soon as they wake up and recover afterwards. We'd like the kids to be picked up and held, to be nursed if nursing, but just everything as normal as possible. Emphasizing that family-centered approach really yields the best outcomes possible. One of the procedures that we're really proud of here is a minimally invasive endoscopic approach to children with craniosynostosis. These procedures are much shorter, the amount of blood that's lost are much less, and the need for a blood transfusion afterward is much less. As well, the children have very little swelling after surgery, they return to their normal activities right away, and they usually go home a day or so after the procedure. In up to 90% of children now where we're doing craniofacial procedures, no transfusion of blood required at all.
Right before the operation, we have a tumescent that's got epinephrine in it. That epinephrine works to contract down blood vessels. And by doing that early on and really letting that sit in the scalp for about 20-30 minutes while we get the patient prepped and draped and ready for surgery, it has its maximal effect. And then we spend quite a long time doing the dissection very meticulously to prevent any small little blood vessel that might bleed as we elevate that soft tissue off the skull.
The types of innovative procedures and operations that we're doing here at WVU Medicine Children's Hospital, including our bloodless surgery program, are really done nowhere else in the world.
We are the only ACPA accredited cleft and craniofacial program for the entire state. The ACPA really sets the standard for the country on how we should take care of babies with these problems, with these craniofacial differences.
This really is the best place possible for your child to have a craniofacial procedure.